Assalamu alaikum. Let's talk about tricyclic antidepressant overdose. If we look at the clinical feature, tricyclic antidepressant. First, what is tricyclic antidepressant? Tricyclic antidepressants inhibit, it actually inhibits serotonin and norepinephrine, serotonin and norepinephrine and are effective in the treatment of depression as well as other psychiatric and medical conditions. Its mechanism of action is reuptake of serotonin and norepinephrine at the synaptic cleft, and it these increases the serotonin and norepinephrine concentration may result in therapeutic effects on the mood and the pain. Therapeutic effects in the mood on the pain. It is used in major depressive, obsessive compulsive disorder, insomnia, chronic pain, and anorexia. If we look at the if we look its pharmacology and its adverse effect, then we can easily assess the TCA overdose. Okay, we know that tricyclic antidepressant it has inhibitory effect over central and peripheral muscarinic acetylcholine receptor. Central and peripheral muscarinic acetylcholine receptor, thus causing tachycardia, delirium, dilated pupil, decreased sweat, hyperthermia, ileus, and urinary retention. It can cause urinary retention. Peripheral alpha 1 adrenergic receptor, there is peripheral vasodilatation, orthostatic hypotension, cardiac fast sodium channels, conduction defect, arrhythmia, presynaptic norepinephrine and serotonin reuptake, antidepressant and anxiolytic effect, seizure, tremor, and in histamine receptor it can cause sedation, increase appetite. So it can cause a tachycardia, delirium, dilated pupil, flushing, decreased sweating, hyperthermia, and there may be peripheral vasodilatation, there may be conduction defect. Okay, uh, anticholinergic toxicity we can remember as hot as a hair, dry as a bone, red as a beet, blind as a bat. So hot as a hair, that means increased body temperature, which will decrease. The mechanism is decreased sweating leads to decreased heat dissipation, dry as a bone. Also, there is decreased secretion, mucous membrane, sweat gland, red as a beet, like flash skin, blind as a bat. There may be cycloplasia and mydriasis, and mad as a hatter, like altered mental status, and full as a flask, like constipation and urinary retention, and fast as a fiddle, like tachycardia. I have told all the features of anticholinergic toxicity. Now, try to mix up with these words. What is hot as a hair, like increased body temperature. There is increased body temperature, which leads to flushing, increased body temperature. Okay, there is dry as a bone, there is decreased secretion, every secretion is dried down, so there is dry mouth, blurred vision, there may be urinary retention, red as a beet like a flush skin, there may be blind as a bat like cycloplasia mydriasis, there is hyperthermia, which is hot as a hair, hyperthermia. There may be mad as a hatter. There may be altered mental status change. There may be drowsiness, delirium, and coma, and full as a flask like constipation, urinary retention, and fast as a fiddle. There may be tachycardia and sinus tachycardia, hypertension can happen. There may be prolonged PR, QRS, and QT interval. There may be arrhythmia. So, if you remember the anticholinergic toxicity, the mnemonics, the symptoms, then we can easily assess the tricyclic antidepressant overdose. How we can manage this patient? We can manage. Uh, there is serotonin toxicity. If we think a patient with serotonin toxicity, he's agitated, diaphoresis, there may be tachycardia, there may be autonomic instability and hypertension. There may be diarrhea and hyperactive bowels, and there may be clonus, hyperreflexia, there may be tremor. And management is supportive, supplemental oxygen and intubation, IV fluid, activated charcoal for patient, activated charcoal for patients with 2 hours of ingestion unless ileus is present, IV sodium bicarb, intravenous sodium bicarbonate for QRS interval widening and ventricular arrhythmia. So for QRS interval widening and ventricular arrhythmia, we need sodium bicarbonate. Sodium bicarbonate likely improves cardiac toxicity. Cardiac toxicity following mechanism: increased serum pH makes the TCA less pharmacologically active, increased extracellular sodium concentration raises the electrochemical gradient across the cell membrane, decrease impact of the TCA induced sodium channel blockade. What is the most likely cause of TCA overdose? That is cardiac toxicity, ventricular arrhythmia. So for prevention, we can give IV sodium bicarb for QT interval widening. What is the medication is treated to seizure in patients with TCA toxicity? And it's benzodiazepine. An isolated overdose of SSRI, isolated overdose of SSRI is well tolerated with asymptomatic mild depression. When isolated overdose of SSRI is usually well tolerated, asymptomatic and mild CNS depression. When a patient with SSRI have an altered mental status and abnormal physical findings, levels of common coingestion, salicylates and ethanol should be obtained. So salicylate ethanol should be obtained because isolated SSRI ingestion, it is well tolerated and it is usually asymptomatic. And sodium bicarbonate is infusion for cardiotoxicity. It is indicated if QRS interval more than 100 milliseconds, if there is ventricular arrhythmia, if there is hypertension. It alkalinizes plasma and making the TSA non-ionized and less accessible to bind with the sodium channel. And benzodiazepine for seizures. And if it is less than 2 hours after ingestion and the airway is protected, activated charcoal can be given. 5-stigmin used as an antidote in anticholinergic toxicity is contraindicated in TCA poisoning due to its potential to worsen cardiotoxicity. So 5-stigmin cholinesterase inhibitor used as an antidote in anticholinergic toxicity. So in anticholinergic toxicity, physostigmine can be used, but it is not used in TCA poisoning. Okay, the features of TCA and salicylate, they are kind of similar. In tricyclic and in salicylate, there may be hyperthyroid, there may be hyperthermia, there may be in the treatment. On both cases, we give sodium bicarb, but TCA does not cause any anion gap metabolic acidosis, but salicylate causes. If you do the anion gap, in there may be um, anion gap mixed anion gap metabolic acidosis. So that is all about TCA overdose. Hope you enjoy.